Peripheral arterial disease, PAD, and diabetic-related foot ulcers are fairly common in the UK population. They are both potentially devastating medical conditions. They can cause pain, as well as lead to amputations and other serious events such as heart attacks, stroke, and even early death.
When assessing and diagnosing PAD or diabetes, healthcare professionals need to be fully engaged and clear in their communication with patients on the seriousness and impact these conditions have. Podiatrists are uniquely placed to advise both on the immediate and wider treatment and management. Making patients aware of the need for early intervention, especially when in crisis, can protect limbs and prevent their loss. The College of Podiatry is working with the wider healthcare community to encourage clinicians to engage earlier in the process of managing these conditions, alongside more detailed clinical assessments. Specific advice on the implications of the symptoms seen in PAD and patients with diabetic foot ulcers need to be part of every contact and followed up in writing to the patient and their GP. Thorough vascular assessment of the lower limb, including pedal pulses, Doppler, ABPI, and more proximal pulse palpation, will enable appropriate intervention being initiated, as well as onward referral when required. Having a baseline set of observations to compare to over time is equally beneficial. Knowing the patient demographic is fundamental when undertaking a stratified risk assessment. If they are aged over 40, have diabetes or PAD, or known vascular risks such as tobacco smoking, hypertension, high cholesterol, obesity, and those who do not exercise regularly, should be red flags in your assessment. With early detection and treatment, the chances of survival of both life and limbs can be dramatically improved. The multidisciplinary approach and linking regularly with your colleagues in the wider foot protection team will facilitate speedier patient management. Utilising national guidance from NICE and SIGN would also be important for your patients.
Early identification and treatment, along with key lifestyle changes, can help reduce the risks of amputation, heart attack, stroke, or early death.